You start taking iodine because you've heard it helps with fatigue, thyroid health, even breast tissue. A few days in, you break out. You feel foggier, not clearer, your heart's racing a little, so you assume iodine is bad for you and quit. Dr. David Brownstein says that reaction might not mean iodine is hurting you. It might mean it's working exactly as expected. Today we're breaking down the detox phase, why it happens, and how to actually get through it. Brownstein's explanation for this reaction goes back to something we've covered in this series before. Your body's iodine receptors have likely been occupied for years by chemically similar but harmful substances, bromide, fluoride, and perchlorate. He calls these toxic halides. When you introduce real iodine into the body, it starts displacing those substances from tissue where they've been sitting, sometimes for decades. That displaced bromide and fluoride then has to actually leave the body through the kidneys and through the skin, and that transitional process is what people are often feeling when they describe a rough few days after starting supplementation. In other words, the symptoms aren't necessarily iodine poisoning you, they're often the old occupant leaving. Bromide deserves its own spotlight here because it's genuinely everywhere and most people have no idea. It's used as a dough conditioner in some commercially baked bread. It shows up in certain pesticides. It's used as a flame retardant in furniture and electronics. And it was even used historically in some medications and sodas decades ago. Brownstein's clinical position is that years of cumulative bromide exposure have left a lot of people with a body burden that competes directly with iodine for the same receptor sites. So when iodine starts pushing bromide out, the result can look like skin breakouts along the jawline or back, brain fog, fatigue, or even anxiety-like symptoms for a period of time while the body catches up. To put some numbers to it, Brownstein has pointed out that bromide use in commercial baking and other industries increased substantially over the second half of the 20th century, right around the same time iodine intake from salt was declining. His argument is that this isn't a coincidence. It's essentially a slow-motion swap, where a beneficial halogen was gradually displaced by a harmful one across the population's collective body burden, largely without anyone noticing because neither iodine deficiency nor bromide accumulation produces a single obvious symptom on its own. Based on Brownstein's clinical observations across his patient population, here's what a typical detox reaction can include: acne or skin eruptions, often showing up in new places you don't normally break out, headaches, fatigue that temporarily worsens before it actually improves, a metallic taste or excess saliva, a racing heartbeat or general jitteriness, and sometimes sinus or nasal symptoms that feel a lot like a mild cold. The key thing he emphasizes is that these tend to be temporary and closely tied to the pace of your dose increase. They're not a sign that you should never take iodine again, but they are a sign that you may be moving faster than your body can currently handle. This is where Brownstein's signature technique comes in, and it surprises people because it sounds completely backwards, using salt to help you detox. The idea is that unrefined salt provides chloride, and chloride competes with and helps displace bromide specifically through the kidneys. When someone experiences a bromide-related detox flare, the protocol calls for dissolving a measured amount of unrefined salt in water and drinking it, sometimes paired with increased water intake overall to help move that bromide out of the body faster. It's not a magic eraser for every symptom, but it's a genuinely useful tool for shortening an uncomfortable few days. It's worth setting realistic expectations about timing here, because this is where a lot of people get discouraged and quit too early. A detox reaction following a dose increase typically shows up within the first few days, not weeks later, and for most people following the low and slow approach, it tends to settle within a handful of days once the dose stabilizes or the salt loading technique is used. If you're weeks into a stable dose and suddenly experiencing new symptoms out of nowhere, Brownstein's framework would actually point you toward looking at other causes first. Rather than assuming it's still iodine-related detox, this isn't meant to be a permanent, ongoing state, but a transitional one tied specifically to dose changes. Beyond salt loading, Brownstein's broader framework also points to a few supporting habits that can make the transition smoother. Adequate water intake matters. Since the kidneys are doing a lot of the work of clearing displaced halides, and staying even mildly dehydrated can make symptoms feel more intense than they need to. Some practitioners following his approach also mention that activities that promote sweating, like a warm bath or sauna session, may support the skin's role in clearing bromide as well, though salt loading remains the more central, better documented piece of his actual protocol. None of these supporting habits replace the core approach of starting low, increasing slowly, and pairing iodine with the supporting nutrients. They're simply additional tools that some people find helpful during a rough stretch. If there's one phrase that sums up Brownstein's entire approach to iodine, it's this: low and slow. Rather than starting at a meaningful dose right away, his protocol has people begin with something quite small. Some practitioners following his framework suggest starting around a couple of milligrams or less and increasing gradually, often in small increments every week or two, while also front-loading the supporting nutrients like magnesium, selenium, vitamin C, and B vitamins for a week or two before iodine is even introduced at all. The goal of that lead time is to get some of the body's detox pathway supported and ready before you actually start pushing bromide and other halides out. So what do you do when a detox symptom actually shows up? Brownstein's guidance is that this is information, not a reason to panic, but it is a cue to pause the iodine increase specifically or address the symptom directly using tools like salt loading and let things settle down before continuing forward again. That's meaningfully different from just pushing through blindly and hoping for the best. The goal here was never speed. Some people following his framework end up landing at a much lower long-term maintenance dose than others do, and that's completely fine. The point is finding where your individual body actually settles, not hitting some arbitrary number you saw online. It's also worth mentioning that not everyone experiences a dramatic detox reaction at all. Some people increase their dose according to the protocol and feel essentially nothing unusual the entire time, which Brownstein attributes to a lower existing burden of competing halides in that particular person. If you're someone who's had heavy exposure to processed baked goods, certain medications, or occupational chemical exposure over the years, you may simply have more to clear out, and more of a noticeable transition period as a result. One last thing worth flagging: distinguishing a normal detox symptom from something that actually warrants stopping and calling a doctor matters, and Brownstein is not vague about this distinction. Mild skin changes, temporary fatigue, or a brief headache fit the pattern of a typical detox reaction. Anything severe, chest pain, significant heart palpitations that don't resolve, difficulty breathing, or swelling is not something to wait out at home under the assumption it's just detox and warrants stopping the supplement and seeking medical attention right away. His low and slow philosophy exists precisely, so reactions stay mild and manageable in the first place. A severe reaction is a signal that something else may be going on and deserves a doctor's evaluation rather than a home remedy. The bottom line from Brownstein's clinical experience is this: a rough few days after starting iodine isn't automatically a reason to quit entirely. It may genuinely be your body clearing out something that's been sitting there for years, but it's also not something to muscle through recklessly without paying attention. Go low, go slow, support your detox pathways with the nutrients his protocol calls for, and pay close attention to what your body is actually telling you along the way. If this helped make sense of a confusing part of the iodine journey, subscribe for the next video where we look at the different forms of iodine Brownstein recommends and how to actually choose between them. This video is educational only. Please talk to a healthcare provider familiar with iodine protocols before starting or adjusting your own regimen.